Hi, this is Dr. Kaan of the ACL Academy, and today I'm going to talk about crutches and how we utilize them after ACL surgery, the proper way to utilize them, and when to be able to discharge and how to do them safely. Before I get into that, if you guys have been following along and found value from these videos, please subscribe to the channel, like the video, questions, comments, drop them below, and of course, share with a fellow ACLer that can benefit from these educational videos. We drop one every Monday on our channel. So crutches, right? After ACL surgery, you're going to be discharged with crutches, most definitely. You may be weight bearing as tolerated, or you may be non-weight bearing if you had another procedure along with your ACL reconstruction, including a meniscal repair. If your weight bearing is tolerated, you still be given crutches, and in some cases, being given a long brace or immobilizer just to assist with your walking. Now, we do recommend crutch use probably more than most people, and the reason being is we want to control swelling, number one, and number two, we want you to have a proper gait pattern before you get rid of these crutches. It's so important because we don't want to develop compensations. Early on after your surgery, you're going to have a pain, but you're also going to have a lot of post-op swelling, right? It was a big surgery, stuck a bunch of tools in there, shaved some things down, drilled a hole. Like, it takes some stuff in there. It's going to cause swelling. In the beginning, what we kind of hammer home is we need to manage that swelling. How do we manage swelling? It's time off our feet, time with the leg elevated. Okay, the more you're on your feet, the more you're putting pressure through the leg, you're going to cause more stress to the knee joint. And when you cause more stress to the knee joint, it's going to develop and keep fluid there. Okay, your body's going to have a hard time pumping some of that fluid out because what happens is your muscles act as a pump, right? And after surgery, your muscles kind of go on vacation a little bit, particularly your quad muscle, your hamstring, your calf, right? Those are the main muscle groups that are going to help push some of that fluid out. And when they're not working properly or when they're not strong, you're going to have to depend on rest. You're going to have to depend on elevating your leg. You're going to have to depend on compression, keeping the knee joint compressed. These are things that are going to help with that. So we have to stay on top of that stuff. Now, people want to rush off their crutches because they feel like they're going to move forward in the process. And that's something that we do want to kind of hammer home and say, no, utilize the crutches, right? Utilize them as to take pressure off your knee joint as well as to help with your gait pattern, right? The faster we can normalize the gait pattern, the better it'll be. Now, with crutch use, okay, the way that we know that you're getting ready to get rid of crutches is you need to have full extension motion, okay, that's full straightening, and you need to have at least 45 degrees of flexion, but I will tell you should have more than that. But more importantly, you need to have what we call quad control, okay, which means you need to be able to turn on your quad muscle, you need to be able to activate it pretty easily, and then there's a test that some people use that show some control where can you do a straight leg raise that's laying on your back, leg nice and stiff, and lifting the whole leg up in the air, controlling it down without it bending, right? So can you demonstrate a proper straight leg raise without what we call knee lag or quad lag, where the knee is bending? Okay, those are the things that tell me that you're ready. Okay, in the meantime, though, you're still going to utilize crutches early on after surgery. If your weight bearing is tolerated, you'll have both crutches in hand. And basically, let's say my left leg was the ACL leg, you're going to step with the crutch, okay? So it's not the crutch first, then the leg. You want to put the crutches down and the leg down at the same time, and then advance the other leg, okay? Crutch and foot, same time, then advance the other leg, okay? That's how we want to do the gait pattern off the bat. Now, once we're getting that full extension, once we're getting good quad control, instead of getting rid of the crutches completely, what we suggest is moving to one crutch. Okay, so again, my left leg is the ACL leg. We want the crutch in the right hand because we want to mimic the proper gait pattern, number one. We also don't want to keep it in the left hand because then we're going to be leaning to the left side, and that's our, healing side, right? We don't want to be leaning too far over that way while we're walking, okay? We want to mimic the good gait pattern, and we also want to be able to take some pressure off my ACL leg, which is my left leg, right? So similar to the gait pattern, my opposite arm advances with the surgical side, right? So as my left leg advances, and now I have similar to what we want as a proper gait pattern. Left leg, left crutch, right leg forward, left leg, left crutch, right leg forward. And then as you're getting better with this type of stuff, you want to encourage yourself, okay, that we strike with the heel. As my body comes over it, the leg goes nice and straight, and then my heel comes up off the floor and the knee bends. You see it from the side. What we say is, as I strike, that's my indication for the knee to go straight, my quad muscle to be squeezed nice and tight. My body comes over it, the leg is as straight as it would be. As I advance the right leg, my heel starts to come off the floor, my knee bends, and then I go into what we call swing phase, okay? Again, strike, heel hits the floor. That's my indication for my squeeze the quads, body comes over it, nice and tight. As I'm advancing the other leg, that's when my heel comes up, my knee will bend, okay? So that's the way that we want to work on the gait pattern. And really what I tell most people, it's okay to be on a crutch, all right? So yes, we can move from 2 crutches to no crutch right away, but if we have a bad gait pattern, if we're not utilizing the knee motion, if we're not squeezing our quad muscle properly, we're going to compensate and we're going to develop other issues. So the 2 big reasons why we utilize crutches for, let's say, a little longer. When I say a little longer, it could be anywhere from 2 weeks to 4 weeks. For us, it's we want to take care of swelling. So as long as you can reduce that swelling, get that extension back, be able to activate that quad, then we can start transitioning. But the other side of it is we want to transition you and still teach you the proper way to get off the crutches and utilize a proper gait pattern. If you're using a crutch and if you're not utilizing a crutch, let's say, and you're walking with a stiff leg still, or if you're walking around with a bent knee, right? For me, you're going to cause more issues that way. So we want to help you by utilizing an assisted device, a crutch or a cane, whatever it may be, right? To take some pressure off the leg so you could really work on the pattern that I spoke about, striking with your heel, right? Getting the leg nice and straight as your body comes over it. And then as your heel comes up, your knee is bending while you're going to advance the leg. So you have to be able to control that. So that takes not only the available motion, but that also takes proper quad control. So these are the things that we do work on. And I hope you guys find this helpful. And for you, it's not a matter of rushing off crutches. Utilize the crutches, get the swelling down, work on your gait pattern, and then when you begin to walk, you walk properly, so we don't have to reteach you and relearn how to walk again and to work you out of those compensations. Guys, if you found this helpful, please like the video. Please subscribe to the channel. Questions, comments, drop them below. And of course, please share them with fellow ACL that could benefit from these videos. This is Dr. Kaan. We drop a video every Monday on our channel. Look forward to seeing you guys next week. Signing off.